Hi there, I'm Dr. Strube. I'm a chiropractic physician in Pinellas Park, Florida. I'd like to talk with you today for a moment or two about neck problems. Neck pain is common these days, and one of the most common reasons for neck pain is automobile accidents. The neck is particularly vulnerable to injury should you be involved in a motor vehicle accident. If a neck is having a problem, if there has been an injury, there are a number of things that can be done for it. You've got medication. Basically, there are three different types. They would be anti-inflammatory, muscle relaxer, pain pills. These can be helpful in the early stages just to make life a little more comfortable for you. But oftentimes, if there is any significant injury or problem, there are other things that should be considered and quite possibly should be done. As a chiropractor, what I do primarily is adjusting or manipulation. However, on a new injury, when someone is in acute pain, that would not be indicated, and there are other things that would be more appropriate. Things like traction, possibly, gentle massage, physical therapy, and other types of treatment equipment that can make a big difference not only in how you feel today, but in what the final outcome is going to be. Because with injuries from automobile accidents in particular, if they are not treated correctly, you stand a reasonably good chance of having problems down the road sometime, and by that I mean 5 years or more, that are directly related to the injury, but you may have long since forgotten about the injury when the new problems show up. And what I'm going to do is show you some gentle adjusting, show you some of the other pieces of equipment and things that might be done for significant neck problems. I'm going to demonstrate a cervical manipulation, and this young lady has some problems with her neck. We're going to do a little gentle adjusting in that area. The adjusting is more to restore normal function to the area than it is to put a bone back into place. That's kind of an antiquated view of what takes place. It's more to help to get things to work the way they're designed to work. What I would do is take my hands and I would locate the areas where things are not functioning correctly. We would then give a gentle little push there, and that's all there is to it. It is not anything that is particularly forceful or uncomfortable, but it is designed to help restore normal function, get the person feeling better. If things are working the way they're supposed to, you feel better. I want to do a quick demonstration on the use of this piece of equipment. Oddly enough, this is called an ATM. I know. It stands for active therapeutic movement. And the theory is if you can stabilize an area perfectly that did have a painful movement, in this case it was bringing the head forward, hurt the neck. If we can stabilize that upper torso in a way that then allows the patient to bring their head forward with no pain, the treatment is to have them do that several times. What we would do is we would just snug these straps up when we achieved pain-free forward motion of the neck. The patient would do that several times, and that would help alleviate their neck pain.